We have developed, working with educators and other health officials, we've developed a set of guidelines backed by science that each school should follow when developing their reopening plans. This approach allows schools to adjust their rules to what works best for them to create a safe environment and one that will protect students and staff from the spread of COVID-19. We know that COVID-19 is mainly spread through contact with an infected person's respiratory droplets that come from sneezing, coughing, yelling, or even talking. And because school buildings are indoor settings, with students and staff in close proximity for an extended period of time, they are prime places for the spread of COVID-19. We know that generally it is important to get kids physically back in school. While teachers and students did an outstanding job of implementing distance learning this spring, the American Academy of Pediatrics strongly recommended that students should be, quote, physically present in school as much as possible. They emphasize that there are major educational, health, and social benefits for keeping most students physically in schools. And so to be able to keep schools open, each of our guidelines is designed to create the safest environment possible for our students and staff. I'd like to spend a few moments now briefly outlining each one, but specific details about guidelines will be made available in the comprehensive document that I just held up, and it will be available when our website is free at coronavirus.ohio.gov. Guideline 1, vigilantly assess symptoms. Now, let me just say that these first guidelines are not going to be a great surprise to anybody. COVID-19 spreads so rapidly, it's essential that students and their caregivers, staff, and volunteers conduct daily health checks prior to going to school that include taking temperatures and assessing for symptoms. Anyone with a temperature above 100 or with any COVID-19 symptoms must stay home. If there is a higher risk of COVID in a community, schools can scale up this guidance by taking temperatures of students and staff as they enter the school building, for example. School administrators must send home students and staff if they develop symptoms or a temperature at school, and they must refer them to an appropriate health care provider or a testing site. Further, they must contact their local health department if there is a case of COVID in their school. Since testing is one part of a comprehensive strategy to protect against the spread of COVID-19, schools must work with their local health departments to implement a testing strategy. Let me just say that I've been very pleased as we've talked to health directors, as we've talked to schools, that by and large, from what we can see, that close cooperation is taking place. Guideline 2, again, no surprise, wash and sanitize hands to prevent spread. According to the CDC, hand washing and other common prevention methods are some of the most effective ways to reduce the spread of infectious diseases. Therefore, schools must provide ample opportunity for students and teachers to wash their hands throughout the day. To supplement this, schools must provide hand sanitizer in high-traffic areas, including entrances to the buildings, classrooms, and require its use. Guideline 3. Thoroughly clean and sanitize the school environment to limit spread on shared surfaces. COVID-19 can spread by touching a contaminated surface and then touching your mouth, your nose, or your eyes. According to the CDC, using disinfectants reduces the spread of infectious diseases. And I would say that although I'm not reading it all the way through this report, there will be places where you can click on and get these guidelines or get these sources of information the way it has been written. Number 4, practice social distancing. We know that social distancing of at least 6 feet can reduce the spread of infectious diseases. The spread is further reduced when other preventing measures are layered on. Schools should strive to maintain 6-foot social distance among students, staff, and volunteers as often as possible in all school environments, including classrooms, hallways, restrooms, cafeterias, playgrounds, drop-offs and pickups, and on school buses. Implementing this guideline will certainly make things look different in every school. And schools are just different. And that's why there's a great deal of flexibility, obviously being allowed, as it should be, for the schools and the people that run the schools to determine how to implement these aspirational goals. Some schools may decide to stagger lunch times. Others may decide that students should eat in their classrooms rather than in the large cafeteria. Other schools may implement modified schedules to reduce crowding. Schools can help encourage social distancing by posting visual cues and reducing large groups mingling. Number 5, face covering policy. Every school should develop and must develop a face covering policy. Scientific studies show that using face coverings can significantly reduce the spread of COVID-19. Let's talk about the staff at first. Just as we have done in the business sector with employees who work in other businesses, other occupations, we are requiring school staff to wear face coverings to reduce the spread of virus unless it is unsafe or when doing so could significantly interfere with the learning process. Again, very similar guidelines, almost word for word, in regard to school and in regard to what we've already put in place with other workers. When face coverings are not practical, face shields may be considered. For example, wearing a face mask could make communication more difficult in some cases when teachers are interacting with students, students maybe with disabilities, maybe younger students, or students who are learning a foreign language. Because of the importance of face masks in slowing the spread of COVID-19, schools must, as I said, establish a face mask policy. In so doing, they should consider all the available science. It is the state's strong recommendation that children third grade and up should wear face masks. Now, I have tried, and I know the health department and the education department have tried to read about every piece of evidence and information and studies that we can in regard to this. There's clearly a strong consensus among health and children's experts that children 6th grade and up should wear face masks unless there's a medical or developmental reason for that child not to do so. And I want to emphasize, because I've heard from different parents about this whose children cannot wear a face mask, the school should work to reduce and do everything in their power to reduce any kind of social stigma for a student who, for medical, developmental reasons, cannot and should not wear a mask. So our recommendation is 3rd grade and up, strong recommendation. Again, we ask the schools to look at the science and develop a policy. They should look to the best science in developing a face mask policy. I would imagine that some schools will be comfortable in starting masks in kindergarten, some 1st grade, some later. The majority opinion, as far as we can tell, among experts, appears to be that children kindergarten through 5th grade can wear a mask as long as allowance is given for the age and developmental level of that child and the physical situation that the child is in at that particular moment. That's a long way of saying we just use common sense. We follow the science, we use common sense in regard to how it gets implemented. We wear face masks to protect each other, often because people are sick, but people show no symptoms. Masks can be especially useful and are strongly recommended at any grade level during periods of increased risk when physical distancing is difficult. And obviously, when someone is on a bus, schools are going to have, and I'll talk in a moment about buses, but schools are just going to have an inherent problem in regard to buses. So, certainly riding the bus, picking up meals, families, schools, and students should use as much as possible the face mask to decrease the spread of this virus. To assist the schools in our efforts to implement our 5 guidelines, the Ohio Department of Education has created a document. Again, I held it up. The Reset and Restart Education Planning Guide for Ohio Schools and Districts. So actually, there are 2 separate documents. One is the more educational document. The one is the more health. They can bring them together, and both should be looked at.